Hello, everyone. My name is Rashida Folarin, a Purdue Global University student. This is the final week of my clinical experience. I have been asked to uh, discuss about my goals and how did I begin, and then did I meet my goals over the past 10 weeks? Yes, I did. I started without knowing much about cognitive behavioral therapy. Right now, I fully understand what it is. I know it can be used alone as well as in addition with medications and some other supports. I've learned so much. My goals were achieved with the assistance of my clinical preceptor as well as instructor. They both assist me in achieving my goals of learning about multiple mental health illnesses as well as treatment for every single one of them. So I achieved my goals. What feelings, prejudices, or biases did I experience during the clinical experience, and how did I manage them? I really did not. Fortunately for me, I was lucky. I did not experience anything. As a matter of fact, in that kind of, I did not experience any biases or make me feel like um, I'm not comfortable around certain people of certain cultures and beliefs. I did not experience that, regardless of my cultural belief as well. I was so comfortable and everything went smoothly. I can say that I was able to interact with so many patients with from different backgrounds and ethnicities, and um, some of them are from my ethnicities, and I was able to, sorry, some of them are from my ethnicity. I was able to help them achieve their healing goal. Like, I was able to translate for them. Some of them, they think I speak their language because of my look, and I did not speak their language, but I get more connect with them because of the cultural differences. So that was a very good experience for me, by the way. How did I manage my anxiety, self-doubt, or uncertainty? That's a very good question. That's why um, resources for students are very important. I was able to utilize my resources. I know how to go to my clinical preceptor to ask questions when I'm not sure. I didn't really have that much anxiety in terms of prescribing medications and or reviewing patients' medications, because I was not allowed to prescribe while I'm still precepting. I mean, why I'm still in the clinical. But I asked my clinical preceptor a lot of questions, and many questions, and then she was very resourceful, and then I really didn't have that much of anxiety. And then I make sure that I double check myself to um, you know, uh, to like clear my uncertainty before I do anything, so that I'm not in trouble, and I keep my patient safety as my priority. And then what understanding or insights did I develop during my clinical experience? Interesting. I was able to understand patients' right. I was able to understand that it is very important for them to be part of the um, treatment plan. I was also able to understand that many of them don't have family members or support system, and it is my responsibility to provide them, at least guide them towards the in getting the resources they need is like so important. And I find that interesting because I become patients' family at that time. Become their everything they can reach out to, and then because most of the time, some of them just want to talk, and because they don't have anyone to talk to, they are lonely and they are, you know, fragile and so depressed. And talking to you as their, talking to me as their potential healthcare provider kind of give them relief and sense of belonging. So it's a very good thing for me to experience. Has reflective practice impacted me as a person, student, or as a provider? If so, how? It has really, because for me to be able to take care of the patient, I have to reflect on, what they're going through, why are they going through it. To stay in my lane, I think he has impacted me in all ways, as a person, as a student, and as a provider. Because as a student, my reflective assists me to learn about each patient based on their clinical presentation. And then as a person, I kind of like try to build that relationship to show them I'm a nice person, so that they're not afraid of talking to me or sharing their problem with me, so they can be comfortable with me. Because nobody wants to deal with a bad person or mean person, especially these people already going through so much. You really want to be there for them and be calm, so that they can be calm, to put my feelings aside and just reflect on how to help them. As a provider, to be able to use the appropriate guideline to take care of these people in a timely manner, and then by, creating goals that is measurable, as well as tangible, that is appropriate for each patient based on their illnesses. Also, the last question is, will I continue to use reflection in my future practice? And if so, why and how? Again, ability to reflect on patient's condition, has helped me to learn more about the cause, as well as taught me how to care for these people properly. He has developed my strength, as well as I have overcome my limitations, and I have grown so largely. Not using those knowledge will be like a waste. So it only makes sense to continue to using the reflection in my practice in the future, by engage with patient, talk to them and assist them to open up, get involved in open ended conversation, like maintain privacy, remain professional, and then really build a boundary, build a boundary, as well as make them feel comfortable with me, and continue to be professional, and then serve my community, and add to the availability of more mental health providers out there to help alleviate anxiety, depression, suicidal, and then drug abuse in our community. I look forward to taking care of so many patients and help them achieve their healing goal, as well as treatment journey, to end up in a very good way. Thank you very much. Take care. Bye.